October is Eczema Awareness Month, and in today's video, we're going to be talking about one of the most frustrating types of eczema to cope with, which I know many of you struggle with, eyelid eczema. Eczema is actually an umbrella term for several different skin conditions. When eczemas involve your eyelids, you can have these red, flaky, itchy patches on the upper and or lower eyelids. Usually involves both eyes, but sometimes just one. You may even have symptoms in your eye, including watery eyes, bloodshot eyes. You may find yourself rubbing your eyes a lot because they are so itchy. With time, the skin around your eyes can become thickened, rough, wrinkled in appearance. If you have a deeper skin tone, you may start noticing that your eyelids appear much darker than your background skin type. Eyelids are particularly vulnerable to developing eczema because of the way they are built. Eyelid skin, if you weren't aware, is very delicate. It has a very thin protective layer in comparison to other areas of facial skin. The lipid content of eyelid skin is much lower as well, so there's less of a protective barrier. Furthermore, if you just take a look at the anatomy, practically around your eye, you'll notice that there is a lot of folding of skin. Part of that is related to your eye muscles that blink your eye. They contract like an accordion, and in doing so, they can trap irritating substances to the eyelid. If you have prominent under eye hollows, things can settle there that end up being irritating to eyelid skin. Just keep that in mind as we move forward. In order to heal your eyelid eczema, the most important thing to first address is, what type of eyelid eczema do you have? I will often get questions, please recommend a good eye cream for eyelid eczema. Don't go searching for an eye cream for eyelid eczema without first knowing what type of eyelid eczema you have. There are different types of eczema, each with their own specific approach to management and to healing. If you use an eye cream, the wrong type of eczema, you can actually make it much worse. What are the types of eczemas that affect the eyes? There are three main types. Contact dermatitis is actually the most common type of eyelid eczema. There's also atopic dermatitis, and third, seborrheic dermatitis. And we're going to break down each of these three main categories of eyelid eczema. Let's start with the most common, contact dermatitis. Contact dermatitis, as the name implies, is an eczema that is triggered by things that come in contact with your skin. Like I said, eyelid skin is very vulnerable to developing an eczema to things that come in contact with it because it's so delicate. It's not as robust in terms of its protective outermost layer, and the nature of eye muscles lead to trapping of things that are irritating to eyelid skin. Now, there are actually two different types of contact dermatitis to further complicate matters. There's allergic contact dermatitis, meaning you have developed an allergy to something that is coming in contact with your eyelids, and every time you come in contact with that allergen, you're going to get worsening of your eyelid eczema. In contrast, an irritant contact dermatitis is an eczema that is triggered by something that comes in contact with the skin that is simply irritating, meaning there's no true allergy there. Your immune system isn't coming in and recognizing something that it has decided is offensive. The substance that is an irritant is simply, well, irritating, especially to the delicate, lipid-poor skin of your eyelids. When it comes to contact dermatitis of the eyelids, allergic contact dermatitis ends up being a lot more common than irritant. Common causes of allergic contact dermatitis, pretty much anything that comes around the eyelid area, including the lash line and the lashes themselves. Whether that be your skincare products that you use directly to your eyelids or to the rest of your face that gets transferred there. Whether it be your eye makeup, eyeshadows, eyeliner, mascara, lash care products, even your lash curler can be triggering your eyelid dermatitis. You can also be allergic to medications that are coming in contact with the eyes, whether that be a topical medication that you're applying to the eyelids or a medication that you are putting directly in the eye. You can be allergic to substances in those medications that you are putting in your eye, including, say, for example, preservatives would be a common one. You also can become allergic to contact lens solution, and that can trigger an eyelid dermatitis. You can be allergic to your hair dye, to your shampoo. Eyelids are one of the first territories where those types of allergies start to show up because those allergens are easily transferred to delicate eyelid skin as you rinse those products out. You can be allergic to things you are using to manicure your nails, whether that be nail lacquers or nail adhesives, components used in constructing gel manicures, for example. There are allergens in those things that can easily be transferred to the eyelid skin and contribute to an eyelid dermatitis. And a very common cause of eyelid dermatitis is actually allergic contact dermatitis to gold, jewelry being an offending agent, such as your rings transferring that allergen to the delicate eyelid skin. What about irritants that cause eczemas of the eyelids? Well, probably face washes and exfoliants would be common causes of irritant contact dermatitis to the eyelids. These are things that can take away some lipid from skin's outermost layer and also can, well, exfoliate. Eyelid skin may not be as readily accepting of these types of products, so you have to be careful. You can also get an eyelid dermatitis from, say, your tretinoin or your topical retinoid getting transferred to delicate eyelid skin. So those are some things to keep in mind. Now, in order to heal contact dermatitis of the eyelids, you must identify the causative agent, what it is that you are either allergic to or easily irritated by. So you really have to do some sleuthing. You have to think about everything that you're coming in contact with, and not just new stuff, because allergic contact dermatitis can develop to things that you have used for years and years and years with no prior history of any problems. In order to determine if you have an allergic contact dermatitis to something, you need to see a board-certified dermatologist for something called patch testing. This can help identify the allergen that is causing your dermatitis, and thereafter you absolutely have to avoid that specific allergen. Any product that has that allergen that is causing your eyelid dermatitis, your eyelid eczema, you have to avoid it. You might also have a contact dermatitis related to aeroallergens, such as certain pollens, grasses. So you can't ask the question, what is a good eye cream for contact dermatitis of the eyelids, without first knowing what it is that is causing the contact dermatitis. Because guess what? The offending agent might be present in any random eye cream out there. One of the safest things to use would be a petrolatum ointment. Petrolatum is a skin protectant. It might limit access of allergens and irritants to the eyelid skin. It's virtually impossible to develop an allergy to petrolatum, so that would just be plain petroleum jelly, such as what is found in Vaseline Original Healing Jelly or the store versions of this. In addition to avoidance of the offending agent, your dermatologist might prescribe some medications to use on the eyelid to help clear up the eyelid eczema faster. Let's move on to atopic dermatitis. Now, atopic dermatitis is a condition where you have a few things going on. It's related to your genetics, it's related to exposures, triggering flares, and it's related to an underlying issue with your skin barrier. Most people who have atopic dermatitis, they have a deficiency in certain constituents of the lipid barrier, allowing allergens and irritants better access. They also have some immune dysregulation at the level of the skin as well that leads to these inflammatory responses. So there are multiple factors that go on to explain atopic dermatitis. Atopic dermatitis can flare and involve the eyelids. Triggers for an atopic dermatitis flare around the eyelids might include dry weather, a drop in the ambient humidity, leading to more water loss from the skin, more dryness and itch. Also stress, underlying illness, changes in the seasons as we go from the more humid summer months into the colder months, again, with the drop in ambient humidity. Now, people who have atopic dermatitis, they frequently have some other things going on as well. Not always, but oftentimes they will have a history of hay fever, allergic rhinitis, seasonal allergies. They may also have a history of asthma. It would be very unusual to have atopic dermatitis solely affecting your eyelids. It's pretty typical to have flare-ups elsewhere, like maybe a hand eczema, for example, or itchy patches on the backs of the knees, the inner aspect of the elbows. Say when you were a child, maybe that's something you dealt with. That's more in line with atopic dermatitis. Patients who have atopic dermatitis that involves their eyelids, because it is so itchy, over time the rubbing and the fluid accumulation from all of the inflammation can lead to a prominent under eye crease known as a Denny Morgan fold. I have a whole video all about this, so check that out if you want to know how to improve upon that. But long story short, controlling the atopic dermatitis is key. When it comes to controlling atopic dermatitis, there is no magic bullet. It has to be treatment that is tailored to the individual patient. Your dermatologist might prescribe specific medications tailored to your individual needs. They may also recommend use of a barrier cream, a moisturizer, an emollient, which is a mainstay of reducing flares of atopic dermatitis. And last but not least, let's talk a little bit about seborrheic dermatitis. This is a skin condition that appears in areas where you have a lot of oil glands, like your face, your scalp, your upper chest, and your upper back. It's related to a little yeast that naturally lives on everyone's skin and thrives in these oily areas, known as malassezia. Now, malassezia is a normal part of everyone's skin, but patients who have seborrheic dermatitis appear to have an overabundance of it, and they appear to mount an abnormal inflammatory response against it, leading to the development of these flaky eczema-like patches, often, for example, on the eyelids, the eyebrows, the forehead, the sides of the nose, the upper chest, the upper back, the sides of the neck. They come and go, tend to be triggered by stress, an underlying illness, illness, sometimes changes in the seasons, and certain medications. Hormonal changes that lead to more oil production can flare seborrheic dermatitis, as well as certain medications that impact oiliness. A lot of patients who have seborrheic dermatitis have its scalp equivalent as well, which is known as dandruff. Dandruff, you have, well, flakes in the scalp. For whatever reason, it seems as though a flare of the flakes in the scalp can coincide with, well, a flare of the facial seborrheic dermatitis. Patients with seborrheic dermatitis on the face, the eyelids, do benefit from incorporating a medicated anti-dandruff shampoo for regular scalp cleansing, using it at least once a week. Now, check out my video on anti-dandruff shampoos for a breakdown of those different ingredients, but treating the scalp can actually end up helping in the long run with supporting reduction in flares of the eyelid seborrheic dermatitis. Some patients also do well using these medicated shampoos or bar soap equivalents as a facial wash for reducing the burden of that Malassezia yeast and helping to control inflammatory responses against it, ultimately helping to support clearance of the, well, seborrheic dermatitis of the eyelids. Eyelid seborrheic dermatitis, your doctor might prescribe certain medications to clear it up, to control it. They may advise you to use these at the first signs of a flare for a period of time. So now that you know about the three main types of eyelid eczema, let's talk about medications. Medications become a little bit tricky in this area because, again, the eyelid skin is quite delicate, it's quite thin, plus you've got the eye there, and certain medications can be harmful if introduced into the eye. One of the most common classes of medications used to manage all different types of eczemas, including the ones mentioned here, seborrheic dermatitis, contact dermatitis, and atopic dermatitis, is medications in the class known as corticosteroids, things like hydrocortisone, triamcinolone, betamethasone. Unfortunately, these can be very problematic to the eyelid skin. Now, it's reasonable to use weaker strengths of these medications for a short period of time to the eyelids to rapidly clear up the eyelid eczema that may be important in some cases, depending on the overall severity. In other cases, you may get away with never needing to use these, but we try and avoid them, and we definitely try and avoid using them to the eyelids for a long period of time. But we do our best to avoid using topical corticosteroids around the eyelids, only using them for a short time when needed in a weaker strength. The reason we try and avoid them is because they're more likely to cause side effects to the eye area. Thinning of the eyelid skin, which is already thin to begin with, but they can negatively impact the health of your eye, putting you at risk for glaucoma and cataracts. But no worries, we do have some alternative medications, and new medications are coming out all of the time that are a lot more sophisticated in terms of the aspects of the immune system and the inflammatory responses that they target. For a very long time, we have had a class of medications that tends to be the go-to for eyelid eczemas, calcineurin inhibitors. These include topical tacrolimus and pimcrolimus. These go by the brand names Elidel and Protopic. We also have a topical medication that is an inhibitor of something called phosphodiesterase that can more specifically help with the inflammation and healing of the eyelid eczema. This goes by the name crisaborole. Crisaborole, as well as the calcineurin inhibitors, tacrolimus and pimcrolimus, while they can be very safely used in this area, unfortunately they often can sting and be a little irritating. Now we have a newer class of medications known as JAK inhibitors, otherwise known as Opzelura, which can also be safely used in this area. So those are some medications that might be pursued by your dermatologist, but again, it's going to come down to what is the root cause of your eyelid eczema. There is no single eye cream out there that is actually a solution to eyelid eczema, but rather you have to figure out the underlying cause, and in the case of contact dermatitis, you have to identify the offending agent. When it comes to applying topical medications to the eyelid areas, a few recommendations. You don't need much. You want to apply a very thin layer. If you apply it too thick, it becomes problematic because it can easily transfer into your eyes and cause issues. So make sure you're applying a very, very thin layer. If it's thick enough that it looks goopy or that it looks as though you could actually remove it with your finger, that's way too much. Also, I suggest when applying medications to the eyelid area or topical ointments such as petroleum jelly, try and avoid getting them too close to the lash line. That way you reduce the chances that they end up getting into your eye. How close should you go? You want to avoid within about 1 to 2 millimeters of your lash line. This is roughly the diameter of a cotton swab stick. So if you have a cotton swab laying around the bathroom, just get the stick, put it, up close to your lash line so you can kind of approximate how far away to go. Another intervention that can be helpful for soothing the symptoms of eyelid eczema is to do cool compresses. You might buy a cool compress in the drugstore. You can also make one yourself by getting a sock and filling it with rice and chilling it in the refrigerator or freezer and applying it to the eyelids chilled. Not only will this help reduce the itch, but it also can help with the swelling. All right, guys, that's a wrap up with regards to eyelid eczema eczema. I really hope this video was helpful to you. On the end slate, I'm going to put one of my other eczema videos. Make sure you check that one out next for more eczema skincare tips. But if you like this video, give it a thumbs up, share it with your friends, and as always, don't forget, sunscreen and subscribe. I'll talk to you guys tomorrow. Bye!